A groundbreaking new study sounding alarms about the safety of COVID mRNA vaccines, directly challenging claims from public health officials and raising urgent questions about transparency and trust. So using hard data from disease trends, from patient outcomes and immune system analysis, multiple research reports show that heart inflammation risks tied to the vaccines may be far greater and maybe even more dangerous than previously reported, particularly among young men. Joining us now to discuss this is Independent Medical Alliance Senior Fellow of Pediatric Cardiology, Dr. Kirk Milholm. Good morning to you, Doctor. Welcome to the National News Desk. Great to have you.
Good morning. Thanks for having me on.
This new study about the safety of COVID mRNA vaccines was published in the International Journal of Cardiovascular Research and Innovation, as I understand it. Tell us about the scope of this research and really your top findings from it.
So it's a compilation of studies that really have been out there since 2021. We saw a signal in the vaccine product causing problems, especially in the young adults, especially young males, that was causing heart inflammation. And so what we have done is compiled all those different peer-reviewed journals, articles, and data, and put them in one place, easily accessible, with 42 pages and 341 references of our concerns that this is a real issue and these vaccines do little good for healthy children and young adults.
Right. Were you able to distinguish the cause of myocarditis, the differential between a COVID infection versus it being just an adverse reaction to the COVID vaccine?
Yes, it's very clear from a number of reasons that we've been able to evaluate. And primarily, there was a great study out of the Nordic countries that studied 23 million children and young adults, and they found that the people who had the least amount of myocarditis were the unvaccinated. And as you increase the number of vaccine doses, or you use Moderna versus Pfizer, your risk just kept stepping up in terms of your risk for myocarditis. Once again, in a disease state that is really very mild for healthy children and young adults.
You know, initially, this topic was so rare when we first heard about this, myocarditis and the links, to the vaccine. But what does the data reveal now?
So there was a study out of Lancet that showed and looked at all these children who had been harmed by the vaccine and had myocarditis secondary to the vaccine. And they looked at them 90 days out. And a lot of things remained normal, except their cardiac MRI, which showed and continued inflammation and possible scarring of the heart itself 90 days out. Further studies, a new study released by Yale said that they're still seeing free-floating spike protein, which is what that vaccine asks the body to make, which is a cardiotoxin still floating around in the body for over 700 days.
Wow.
It was supposed to just be put in and your body made an immune response and then it went away, but it is hanging around in some people.
So it's not transitory. It's not resolving over time. I mean, there's like long-term impacts we're seeing right now.
Yeah, for certain people, it is devastating and long-term issues for a disease process that they had very little risk for.
Wow. So for more information, you can visit imahealth.org. And Doctor, we appreciate you joining us this morning to talk about this very important topic.
Thank you for having me on.
Of course.